The Supreme Court hands down two landmark rulings this week. Same-sex marriage is a fundamental right, and Obamacare is here to stay. And Governor Brown signs a $115 billion budget on time, but some issues remain unresolved. I'm Mark Sauer, and the KPBS Roundtable starts now. Welcome to our discussion of the week's top stories. I'm Mark Sauer. And joining me at the KPBS Roundtable today are Sarah Libby, Managing Editor of Voice of San Diego. Hi, Sarah.
Hey, Mark.
Good to see you back. Laura Wingard, KPBS Editor. Hi, Laura.
Hi, Mark.
Good to have you today. And KPBS Health Reporter Kenny Goldberg. Hey, Kenny.
Hi.
Well, it's been a huge couple of days for breaking news and a pair of long-awaited historic rulings. The Supreme Court this week established the right of same-sex couples to marry, and they upheld President Obama's Affordable Care Act. On Thursday, the court once again fended off a conservative attack on the Affordable Care Act. A 6-3 majority led by Chief Justice John Roberts shot down a Republican-backed challenge and preserved the president's signature law. And today's 5-4 ruling means same-sex couples now have the right to marry in all 50 states, upholding a string of lower court rulings. It was the culmination of decades of activism by gay rights advocates. Laura, let's start with today's ruling. What was the basic issue before the court?
They were being asked in simple terms, do same-sex couples have a constitutional right to marry in the United States? And today's ruling clearly said they do.
And both of these decisions, they were victories for the court's liberal wing. We won't call them a majority or a minority, and we'll get into that in a minute. But Justice Anthony Kennedy was the key vote on the same-sex marriage vote today. Sum up Justice Kennedy's conclusion for us.
Well, he said that gay and lesbian couples have a fundamental right to marry. He wrote about how marriage is important in our country. He said no union is more profound than marriage, for it embodies the highest ideals of love, fidelity, devotion, sacrifice, and family. And then he concluded that same-sex couples ask for equal dignity in the eyes of the law. The Constitution grants them that right.
Okay, and very eloquent in almost a kind of a poetic sense here. Obviously put a lot of word and thought into it. Now, the dissent in this case was led by Chief Justice John Roberts. As I said at the opening, when we get to the other major ruling, he was on the other side of the fence from his conservative brethren. But what was John Roberts' main point in this dissent?
Well, and you know, it was kind of historic because he read it from the, you know, he read it in the court, and he obviously wanted it heard. You know, I think he tried to strike a delicate balance and not offend same-sex couples and people who support their marriages. He said that for those who favor expanding same-sex marriage, by all means, celebrate today's decision. So I think he's walking a close line there. But then he ended by saying, but do not celebrate the Constitution. It had nothing to do with this ruling.
Okay, so very clear. One side, the majority, says you find in the Constitution this fundamental right. The minority, the dissenters, led by the Chief Justice, say no, there's no right in the Constitution. And let's hear from one more of a little more colorful dissent here, Justice Anton Scalia. And he was typically more blunt. What did he have to say?
Well, Justice Scalia feels very strongly that there should not be same-sex marriage, and he was kind of taking shots at Justice Kennedy, even at the way his opinion was written. He said the opinion is couched in a style that is as pretentious as its content is egotistic. Of course, the opinion's showy profundities are often profoundly incoherent. So he felt very strongly the other way.
Okay. All right. Well, it does seem pretty clear. There's a demarcation in the sand. Kenny, you look like you're saying something profound here.
Laura, how does this affect the military and how they treat same-sex marriage? Do you know?
Well, same-sex marriage is allowed in the military. This really, before today, 36 states in the District of Columbia allowed same-sex marriage. Now it is allowed in all 50 states in the District of Columbia. Some states were already today prepared and were letting people marry. So, and you know, the military has allowed you to be gay for a few years now. So, and announce it. I mean, you could be gay before, but you can now. You don't have to hide it.
Right, but did they recognize it in terms of benefits and spousal benefits?
Yes, Yes, I think they did. Yes.
So that was settled back when the don't care, or don't ask, don't tell.
Right, and a
issue
previous
was
ruling on court ruling on whether you can get federal benefits.
Okay, and we should note, just as a housekeeping note, these 4 lawsuits today that the court ruled on were brought by folks in Kentucky, Michigan, Ohio, and Tennessee who wanted to see the end to the ban on same-sex marriage in those states. So now the Supreme Court maintains they're above politics. That's really not true. They really, many of these decisions can't just stay in the legal realm.
Right.
They are, of course, wading in. Let's talk about John Roberts. Pretty interesting today because in these 2 decisions, in one he sides with the liberals on the Affordable Care Act, which we'll get to in depth in a moment, and then on this same-sex marriage he sided with his conservative brethren here. So what's going on with Mr. Roberts?
Well, you know, I read a piece yesterday in the Wall Street Journal that said when he was at his confirmation hearings in 2005, he said that he saw his role more as an umpire. He wanted to call the balls and the strikes, but not make not affect the outcome of the game. And I think he has shown over time that he will side with the liberals sometimes and the Republicans sometimes. Yesterday, he was in the doghouse with Republicans. They were, just saying what an outrage it was that he supported Obamacare. Today, the liberals are embracing him, and the liberals are mad at him. So I think he's hard to decide where is he?
Yeah, and maybe is this one where he knew which way Justice Kennedy was going to go, so his vote wasn't going to affect the decision, so he could kind of throw a bone, as it were, to his conservative backers and supporters and say, yeah, yesterday was a different day, a different issue. Today I'm back with you.
Right, but the Obamacare decision was so important to the president, and people are saying he was so profound in his opinion in that means Obamacare, you are not going to be able to challenge it and overturn it. It was definitive. That was a big victory for them. But, he has cited in previous rulings, you and I were talking, in 2013, he struck down a key provision of the Voting Rights Act, which, liberals did not like.
At all, right.
And in 2010, he sided with the conservative majority on the Citizens United ruling that allows unlimited spending by corporations and unions in elections. So I don't think he's somebody you can predict.
Right. Now, this one is settled, as we've said at the outset. This is a constitutional right now. So there's really no coming back at the same-sex marriage issue.
I don't think there is. I think the folks that are opposed to it they're out of luck now.
We do want to hear from one local supporter here today, Todd Gloria, a gay man, of course, and a member of the San Diego City Council. We caught up with him this morning and his reaction to the Supreme Court's ruling.
It's very emotional. This is something that I couldn't have envisioned, certainly as a child, even just a few years ago, to have the Supreme Court validate that there's a constitutional right to marry, to really give this huge quantum leap forward for the LGBT community. This is a really special day. It's a historic day. It's a day that will go in the textbooks, and in doing so will change the lives of millions of Americans.
All right, and we're going to hear a lot more reaction through the day from folks in San Diego and early into next week as we get some local reaction to this. Now, one point before we shift over to the Affordable Care Act ruling on Thursday, it's tempting with these 2 rulings to think of this as a liberal Supreme Court based on these 2 rulings, but I don't think most people think of it that way.
I think we're going to get a lot of 5-4 rulings, and it looks like now it's where does Kennedy stand and where does John Roberts stand. That's going to decide on all issues, and I don't know how you predict, because sometimes Justice Kennedy goes with his conservative brethren. He's a Ronald Reagan appointee. He's not always with the liberal side, so I don't think you can say.
All right, well, let's shift to that 6-3 ruling here, which came down on Thursday. Big victory for President Obama. It's the second time the Supreme Court has weighed in. The second time Chief Justice Roberts, as we said, has backed the president's Affordable Care Act. Can you start with that challenge that the court ruled on? It was kind of a matter of a sloppy drafting of a law, right?
Right, and the people that were opposing the law and challenging it interpreted it as meaning that only states that had established their own health insurance exchange could people qualify for federal tax subsidies? And what the majority opinion said was no. If you look at the whole context of the law, Congress clearly intended that the subsidy should be available nationwide, no matter where somebody lived.
All right, and getting back to Chief Justice Roberts, again, this was a 6-3 decision. He wasn't exactly the swing vote, but he was leading the affirmative ruling here. What did he have to say about why they ruled in favor of this act?
Well, again, he said you have to look at the whole thing in its entirety. You have to look at the law in context. If he read it, kudos to him. I think it was like 1,200 pages. But nonetheless, he said the intent of Congress was clear. Everybody should be entitled to the subsidies, not just people in the 14 or so states that have their own exchange.
All right, now this, of course, on Thursday, ahead of today's breaking news, was a big bombshell this week. Let's hear what President Obama had to say about that court's ruling on the Affordable Care Act.
This morning, the court upheld a critical part of this law, the part that's made it easier for Americans to afford health insurance regardless of where you live. If the partisan challenge to this law had succeeded, millions of Americans would have had thousands of dollars worth of tax credits taken from them. For many, insurance would have become unaffordable again. Many would have become uninsured again. Ultimately, everyone's premiums could have gone up. America would have gone backwards. And that's not what we do. That's not what America does. We move forward.
All right, I'm going to also include here a couple of folks from the loyal opposition. Jeb Bush, a candidate, the Republican candidate for president, he tweeted out, "Americans deserve leadership that can actually fix our broken healthcare system." They're certainly not getting that now from Washington, D.C. Marco Rubio, another Republican candidate, said, "Despite the court's decision, Obamacare is still a bad law that's having a negative impact on our country and on millions of Americans." And of course, the leading Democrat, Hillary Clinton, not surprisingly, said, "Yes, SCOTUS affirms what we know is true in our hearts, and under the law, health insurance should be available, affordable and available to all." So what, Sarah, let's think about if some of these Republicans say, we still want to get rid of Obamacare, we want to repeal this. How likely is that now after this decision? That seems like a mountain to climb.
It seems like a big mountain to climb, and I think a big challenge that they're going to have is frustration from the public that this is basically a settled matter now. And so is this something that you want to keep, throwing ideas up against the wall on how to overturn it, or do people want them to move on to other issues?
All right, Kenny, let's talk about California. Practical impact doesn't really matter either way on this ruling immediately in California because we had set up our own state exchange.
That's exactly right. So even if had the Supreme Court gone against the government in this ruling, California would have been able to offer subsidies because, as you said, they operate their own exchange. So the effect is really negligible in California.
So, go ahead, Laura.
I was going to say, one of the things that's at play here, too, is with Chief Justice, I think the Chief Justice, in his opinion, sort of took Congress to task, talked about if this had not been drawn in such secret, meetings, it wasn't clear. He was kind of annoyed that it had come before the court. He thought that it should not have come before the court. They should have done their jobs and made it clear. So they were being asked to fix something that wasn't done well. But I think also what's happening in terms of if you want to now challenge it, can you tell me if you disagree, the popularity of this law across the nation is helping so many people that all the polls show people love it.
Yeah.
Well, that's funny you say that because just this morning I read a poll that said, 50% say it's flawed, it needs to be scrapped or redone. And I don't understand where that sentiment is coming from or what the rationale is because, as you said, millions of people are benefiting from it.
Do you know where that poll is from?
I don't.
Okay. Well, and you would think the 6 million people who stood to lose or more under this ruling, if it had gone the other way, they're using it every day in doctors' offices and clinics and urgent care centers. You'd think that they and their family and friends are certainly behind it.
I don't understand it. I mean, I don't understand the opposition to it in the first place. I mean, what's wrong with people getting health insurance? I don't see anything negative about that.
Another question on Covered California. How is that working so far, our state exchange?
It's working pretty well. I mean, there's about 1.3 million Californians that have gotten a health plan through Covered California. They didn't quite get to the numbers they wanted this year, so they're going to push hard next year. Each year, each successive year, the open enrollment period gets a little smaller. I think it'll only be 3 months this coming season. So, but I think it's going pretty well. There's still some problems, still some issues they have to deal with. But by and large, I think people are happy with it.
And we should point out who is eligible basically generally for the subsidies under the Affordable Care Act.
A single Californian who makes up to $46,000 a year can qualify for subsidies, and a family of 4 who makes up to $94,000 a year can qualify for subsidies. So that's pretty liberal in terms of the allowance.
The caps on that, but of course it's a sliding scale. If you get a family of 4 that's down in the making, say, $25,000, $30,000 range, they're obviously going to get a larger subsidy.
Or they can go with Medi-Cal, which is no charge at all.
I see. Okay. Now, are we going to likely to see? Let's throw this out for everybody. The challenges to Obamacare stop. We heard some of the bites there from, or the tweets from the loyal opposition on the Republican side. They're going to come at more legal challenges. Are they going to, or are we going to finally have everyone get together and say, hey, yeah, we all agree there's flaws. Let's get together and make this work?
I mean, you're certainly not going to see it stop on the part of people running for president. It's something that really rallies people. As far as challenges within Congress, I think those might slow because, as you said, this was such a definitive ruling.
Right. And, of course, we are already in the 2016 election season, this being just the summer of 2015. This going to be a big issue coming up next year?
I think
Laura?
it's going to start to fade. I don't think it's going to have traction. As we said, even in a lot of Republican states, Republican strongholds, those states are benefiting. Their people are benefiting from this. And so I don't know how you're going to successfully run on it. I think bashing the president is going to be a Republican strategy, but I don't think this is, I think people will say it, but I don't think it's going to bring about change in this law.
Now, Kenny, this whole thing, as we noted in the 2012 election when President Obama ran for a second term against Mitt Romney, he was the governor of Massachusetts. He set up a plan that Obamacare was basically modeled after. Massachusetts still working okay many years later?
Yeah, I mean, they've slashed their uninsurance rate, as we have in California. It's been cut in half since
that's the number of
took
people
effect.
uninsured, yeah.
So, I mean, and nationwide, I think they've taken 8 or 9 million people off of the uninsured rolls. So it is having a big impact.
All right, one last question for everybody on this topic, and then we'll move on to the state budget. Do we see everybody coming together in Congress saying, all right, fine, let's set aside all the politics and make this thing work. It's here like Social Security and Medicare, it's established. Do we see that?
I don't know if you'll see people kind of joining hands and singing the praises of the healthcare law, but as far as people actively writing laws to dismantle it, I think that will slow. If anything, perhaps people will just move on to other issues.
Kenny, can we fix some flaws in this law that kind of everybody acknowledges are
We
there?
could, but we won't. I think the ideological issues that people have with it are not going to go away, and they're going to still be yelling at the moon about it, and I don't see it changing.
Okay. Laura, do we set it aside and work positively on this?
Congress, work positively.
All right. I'll give you the last word on that one, and we'll shift gears. Well, there were several notable things about the $15.4 billion California budget signed by Governor Jerry Brown. First, it was on time. That in itself is something of a miracle. And second was the paltry number of line item vetoes, just 1.3 million worth out of all these billions. So here's what the governor had to say about the budget.
But in this budget, we're helping low-income working Californians with an earned income tax credit. We're spending billions in our schools and spending it in a way that helps those kids and those families that come from the most difficult circumstances. And we also pay down our debts, and we build up our rainy day fund.
All right. So, Sarah, with Democrats controlling both chambers of the legislature and, of course, the Democratic governor, we might have expected rampant spending. They got more money. They got more revenue. Is that really what this budget's about?
Well, in California, it's always sort of degrees of progressivism. And so I think people seem to agree that for a progressive state, this is relatively reined in, mostly because Jerry Brown thinks a big part of his legacy is keeping California really healthy economically. And so you saw Prop 2, this budget puts money in the state rainy day fund, and he really worked to rein in some of the spending that the legislature was seeking.
All right, now two groundbreaking aspects of this governor's budget, and that was the Medicare benefits to children who are living here illegally and an earned income tax credit. Tell us, unpack those for us.
Yeah, so if you remember back to the last governor's race, Jerry Brown and Neil Kashkari both talked a lot about poverty issues, and so that really came home in the budget this year, and this earned income tax credit is something that Democrats in the legislature have been seeking for years. I think they've written at least 7 bills trying to make this happen over the last few years, and they finally got it, so that's really the feather in their cap for this budget.
Okay, and Speaker Tony Atkins of San Diego has been pushing for a long time. I just took that words out of your mouth, didn't I?
Yeah, but I also thought it was interesting that, you know, where the governor is holding the line, Democrats in both houses had lots of things that they wanted to spend lots of money on, and he was like, no, 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 and he prevailed. But, you know, there's a lot of money that's going to go to this program to give these children, immigrant children who are living here illegally, Medicare benefits, and that he, you know, it's clear he's saying these are the policies I care about, and this is where I think our millions should go.
Well, you know, we've discussed on this show before. There's a catch to that, and that is that yeah, they can give millions of new people Medi-Cal benefits, but that doesn't mean they're going to get care. That doesn't mean they'll find a physician or a dentist, let alone a specialist who's willing to treat them, and that's something that wasn't dealt with in the budget.
Yeah, those are some of the issues, and you've done quite a few stories for KPBS, Kenny, about that. The Medi-Cal fees for doctors and dentists, they're low. Tell us about some of the specifics on compared to the national average and what the folks are saying. They won't take new patients, right, a lot of these.
Yeah, I mean, the California Medi-Cal rate is like the 48th worst in the country, and we all know this is a high-cost state, and I think doctors for a primary care visit on Medi-Cal get, I think, $16 to $20. Now, they can't they can't keep their doors open if they take a lot of Medi-Cal patients. Dentists can't either. I think they get $20 for a cleaning. That just doesn't cut it. So while you have doctors and dentists that will treat Medi-Cal patients, many are not taking new ones. And so, as I say again, if you throw 500,000 more children on the Medi-Cal rolls, that's terrific. Where are they going to get care?
Right.
And you've got another problem here. This is in the governor's own coalition. Caretakers for the developmentally disabled, I should say, are upset too. Not a lot of money in the budget for that, right, Sarah?
Yeah, so this is something that got kicked to a special session, and one of those items that it seems as if the governor really threw his weight around during the negotiation phase, and that's why you didn't see as many line item vetoes, because they kind of hashed that all out beforehand. But so this is something that they say they're going to address now in these special sessions that cover lots of things, infrastructure and healthcare. But some people were very upset and rallied at the Capitol.
Right, so these are the kind of issues. So just to be clear, a final budget and passage and all that isn't kind of really final. They're going to have a special section coming up, right? And what are some of the other things we're going to talk about in that special section?
So one of the big ones will be infrastructure, and that was one of the big criticisms that you saw Republicans giving to this budget, is that it sort of kicked the can down the road to deal with infrastructure. And then a lot of different healthcare issues, the developmentally disabled and other money for people who make low incomes.
All right, and as I said earlier on, they have a lot more money. I mean, the economy's better. There have been some fee increases and tax increases and the cap and trade, so there really is a bigger spigot. Is Governor Brown being too conservative here to not fund some of these things?
I mean, I think he takes it really seriously that he brought the state back from, the verge of economic collapse, and I think he really sees having these reserves and building that up over time for, another dark economic period really seriously, and so I think that's why he got so kind of cutthroat.
Kind of conservative on that. We got just a short time left here. There are about hundreds of millions, though, I have read, in cap and trade money that is going to come in, and they're going to have to decide to do something with that. Huh? So
that's going to be a whole other fight. So, we have the budget that's signed, but that doesn't mean any of these issues are over. And so how that money gets doled out is kind of the next looming, probably, showdown as far as money goes.
All right, a couple seconds left. The Republicans really don't have a huge voice in all of this just because the numbers aren't there in the legislature, right?
It's true. The Assembly caucus leader talked a lot about wanting to have dealt more with infrastructure within the budget. She's a big fan of the sharing economy, things like Airbnb, and she wished that some of those issues were addressed within the budget. But not a lot of voice for them.
All right, well, we'll have to see how that goes as we follow that session. That does wrap up another week of stories here at the KPBS Roundtable. I'd like to thank my guests, Kenny Goldberg of KPBS News, Laura Wingard, also of KPBS News, and Sarah Libby of Voice of San Diego. A reminder, all the stories we discussed today are available on our website, kpbs.org. I'm Mark Sauer. Thanks for joining us today on the Roundtable.